Al-Ansar, 24/7, 365.
Doctors and guests on a Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al-Ansar will be held responsible for any ill health caused by the advice given on Radio Al-Ansar.
بسم الله بك نبدا حبك في سلطان جسدي معزك يا عين وحدا مثل النحلة اللي تسدي
أعوذ بالله من الشيطان الرجيم. Assalamu warahmatullahi wabarakatuh to our listeners. Saturday morning on Radio Al-Ansar 90.4 and Marisburg 105.6 FM. It's also the hint of Safar 1448 AH. I am Shabnam Ismail on the PMB Pulse, capturing the heartbeat of our community. Welcome to this morning show. And today we are talking about something that affects millions of people. Yet it is still misunderstood by so many. Skin disorders. With special focus on Virtiligo. Virtiligo is not contagious. It's not a curse. It's not about hygiene. It's a skin condition where the pigment cells stop working and it shows up differently on every person. But beyond the skin, it touches confidence, mental health, and how we see beauty. So this morning, listeners, we are here to listen and to break the myths, because every skin tells a story, and every person deserves to feel seen, valued, and beautiful in every shade. Today we're honored to have Dr. Noufal Raboobee. Assalamu alaikum wa rahmatullahi wa barakatuh, Doctor. And it's great to have you crossing all the way from our 207 West Road Overpool studio.
Wa alaikum assalam wa rahmatullahi wa barakatuh to you, Shabnam, and of course the listeners.
Listeners, Dr. Raboobee is a dermatologist with 37 years in private practice at Westville Hospital. He's a former president of both the Dermatological Society of South Africa and the Virtiligo Society of South Africa. He's also advisory board member of the Global Virtiligo Foundation and author of Understanding Virtiligo. He's also created award-winning awareness books for children in 6 languages. So Dr. Raboobee specializes in vertigo, psoriasis, atopic dermatitis, and viral warts. And we're really lucky to have him on the show today. So doctor, let's start broad. What are the most common skin disorders you see in South Africa?
I suppose that would depend very much on which part of South Africa we are seeing such patients, and also the age of the patients. That makes a difference to what kind of conditions we will see. But I think overall we see a lot of acne in teenagers and young people. We would see fungal infections and psoriasis in older people, but it can occur across the board in any age actually. And we see, of course, what we are going to be talking about more today, that's vitiligo and pigmentary changes like melasma. And in light-skinned individuals, we worry a lot about skin cancers. And I would say that these would make up the majority of the patients that we see. When we were studying, we had to study 2,000 dermatological conditions, and after we qualified, there were another 1,000 to go and learn. So you can imagine that there are a lot of skin conditions.
So, doctor, why is skin health so important to our overall health?
I think our listeners will be aware that the skin, of course, is the largest organ in the body. It keeps noxious substances and so on out. It keeps our fluids in. It plays a very important role in the body. It protects us, of course, from injury and from dehydration. And, of course, the skin is what people see when they meet us. They may be looking at our faces, but what's on that face? What is covering it? They see the skin first. And this is why it needs to present itself in the best possible way. We take care of it because that is what the people who meet us, that is what they interact with before they interact with anything else. Before they shake hands, they see the face, correct?
Correct. You know, Doc, in Marisburg, it's like 4 seasons in one day. And in KZN, the climate does fluctuate. So what role does our climate in KZN play in skin problems?
Maintains temperature. It does all those things. Skin plays a very vital role in keeping the human being intact.
And how does stress, diet, and sleep affect the skin?
Look, stress, a lot of the time when we don't know what's going on, poor stress gets the blame. But stress, we know that it can actually trigger off a lot of medical conditions. It can cause flare-ups of the condition. You're familiar with this atopic dermatitis that you mentioned earlier. A lot of the time, people who are under stress have exacerbations, they have worsening of their conditions. And with regard to sleep, of course, the body repairs itself during that time of life. I mean, the sleep is created so that we can now mend all the things that happen during the day. It allows us to heal. And a balanced diet, although a lot of skin conditions don't have specific diets, it's very important to have a balanced diet because that would give us the vitamins and the antioxidants and all the things that we need to keep us going. I mean, at the end of the day, we are what we eat, basically. And the healthier the diet, the healthier we become because of that.
And Doc, what are the early warning signs that a skin needs, obviously, medical attention?
If something is persisting, for example, and we can look at early signs, for example, we look at moles and see how they are changing. These are early warning signs. We see, with regard to skin aging, we see the fine lines beginning to develop, although that's, one can argue, maybe cosmetic and not so medical, but that's the overall health of the individual. Basically, if one sees any change in the skin, my advice is if something persists for about 2 months, then you know that it's something that needs attention.
I'm sure, Doc, in your...
The bottom line is the earlier one sees a doctor for a condition that's beginning, the easier it is to treat, of course.
So, Doc, in your profession, I'm sure that you've seen many people try home remedies. And what's the biggest mistake you normally see when people are trying to treat skin problems at home?
Perhaps I could give you an example. For example, using the wrong treatment or going by somebody's experience to say, look, take this, they have a fungal infection, they're given a steroid because it's helped somebody's eczema. The cream is put onto the fungal infection, it would feed the fungus and make it worse. And this is the problem, that if an incorrect medication is used, it can actually worsen the condition. And I think it's very important, of course, to get a diagnosis and then treat according to that diagnosis. So whether it's the general practitioner or the dermatologist, it doesn't matter, but see a doctor, get a diagnosis, and get the appropriate treatment for that condition. Now, I mentioned to you the example of steroid and fungus, but you know that nail changes, for example, fungal infection of the nail and psoriasis of the nail can look very similar. And one would normally take a nail clipping and send it to the laboratory and get a diagnosis. The two treatments are so different that we need to make a diagnosis first. And often we find people taking an antifungal, say, for 9 months to fix up a nail when it's not fungal infection in the first place. The treatment of psoriasis would require injections of cortisone in the base of the nail, whereas the treatment of a fungal infection would be taking a tablet for 3 months, but it takes about 9 months to a year for the nail to grow out. So that's another example. And the issue of of using incorrect treatments also, if I give you the example of acne, for example, this maybe when it starts early, it's the best time to get it attended to, purely because acne is a scarring condition. And if patients leave the acne alone, it will leave pitted holes and so on in the skin. Now, there are a lot of people that want natural remedies and they will stick to the natural remedies, but not realizing that there are treatments available that can actually prevent the scarring. And the important thing is not to assume that nothing is available and not to assume that you're taking the right medication, particularly if it hasn't worked after using it. If you put it on and you find that a month or 2 later nothing is happening, then you grab the bull by the horns and go and get the correct treatment for it.
You heard that, listeners. From the expert himself, Dr. Raboobee, do not self-diagnose. See an expert, because these could be life-threatening to you. So, doctor, are skin disorders on the rise? If yes, why do you think it's so?
I think there's been a great sense of awareness. I mean, this program is exactly doing that. It's creating awareness of skin conditions. There are a lot of people who are going to listen today that will say, yes, I've had this. Maybe it's time for me to go and see my doctor and get it sorted out. Wherever your doctor is, wherever you may be, go and get it attended to. Also, people are living longer with the improvements in medical health that goes on. You know that longevity is another issue. which is associated with skin conditions. And for example, the longer one lives, the more likely it becomes that a cancer will develop somewhere. And we are also getting sophisticated machinery, and with AI and so on, we are able to diagnose a lot earlier. And so this combination of living longer and diagnosing earlier and people becoming more aware, and I think these are the main reasons why it seems as though skin conditions are increasing. But there's also genuine increases in certain skin conditions. When we measure, say, 40, 50 years ago, certain cancers, and we measure them now, there's also the impact of climate change and the impact of where the sun is, and you're getting hotter summers in certain parts of the world. All these make an impact on the increase in the skin disorders.
So let's dive into Virtiligo. Doc, can you tell us in simple terms, what is it and what's happening under the skin?
So in simplest terms, vitiligo is a condition where the skin loses its color and it will show itself up as white patches on the skin. And it's not albinism, that's a different condition. In albinism, the whole body is white and one is born white. There's no pigment at all anywhere. And those patients are at serious risk of skin cancers and so on because there's no protection in the skin. Vitiligo, on the other hand, is usually not present at birth. It's usually an acquired condition because the body is attacking its own pigment and the pigment disappears from that area. And that pigment sits in cells that are called melanocytes. It's interesting to know these melanocytes, by the way, start their journey in a fetus around this area of the neck. It's on the back of the head and the neck. And from there, these cells migrate through the whole body like spray paint. And albinism is when these cells don't make it to the skin and the skin doesn't get any color. But in vitiligo, the cells make it to their destination. But immune cells go and attack those cells and destroy them. That's what happens. And very selectively. It doesn't destroy the neighboring cells. It destroys only the pigment cells. And those areas become white because the pigment cells look after a whole column of cells in the skin. And none of those cells get pigment. So in simple terms, vitiligo is a disease where the skin turns white in patches, and the reason for it is that the body is attacking its own pigment cells and the pigment cells disappear.
And doctor, can you further elaborate? Is it autoimmune or environmental, or is it genetic?
Both, in fact, all three. And there are many other reasons for it as well. There's a concept of antioxidant or oxidative stress. Now, oxidative stress, if I give you a simple example, if you've got a motor car, you're using petrol in the car, the petrol is a useful thing. You need that to drive the car. But it also makes exhaust fumes. And if you lock yourself up in a garage and inhale all those exhaust fumes, you might not be there to record the event afterwards. The same thing happens to melanocytes. Melanocytes use oxygen. But when they use that oxygen, there are byproducts that would come out of that oxygen. We call them reactive oxygen species. It's got a long name. They could have called it waste if you wanted. But the point is these accumulate in the cell and they can actually damage the cell. And we call this oxidative stress. And this creates a cascade of events. In other words, a whole series of events that go on after that actually end up destroying the melanocyte. Because the body detects it now as a cell in distress. The cells communicate with each other and they go and tell the body's policemen, the lymphocytes, that there's something gone wrong with these cells. And these policemen come to the crash site and demolish the melanocyte. This poor melanocyte then exits the skin. It's not there anymore and it can't provide pigment. So this is autoimmune, meaning the body attacks itself. It's not an external force. It's within the body that this happens. And now we know that genetics plays a role because we see often parent and child having vitiligo. The environment plays an important role. I mentioned to you already oxidative stress. Then there's another concept that it may have something to do with nerve fibers because there's one type of vitiligo that occurs only on one side of the body. And it's almost where you have a certain nerve supply. It's where people develop shingles. And some people believe that it may be because certain substances are released by the nerve endings in those places. And this is why you get that type of vitiligo.
So, doctor, let's eradicate the myth once and for all. You might have a kid in school and the parent will say, don't hang out with them. Is vitiligo contagious?
I could see your lip movements, but I couldn't hear you. So could you please repeat your question?
So, Doc, we want to eradicate the myth. Is vitiligo contagious?
vitiligo is not contagious at all. So people who have vitiligo can touch others, and people who don't have vitiligo can touch a patient with vitiligo, can embrace, can hold hands, can get intimate, can do anything within the relationship, of course. Now, the point is that vitiligo cannot be passed on by touching anybody. And this is a very, very important phenomenon, because we have a lot of patients that come to us and say, I'm working as a teller at a supermarket. The customers don't want to touch me, don't want to take money from me. They tell me to leave it on the table. They don't want to touch and take it. So this myth has to be blasted off the sky. We need to inform people that vitiligo is not contagious, and there's no point in not touching and not feeling and not shaking hands and not being personal with patients who have vitiligo. It is not contagious. And if there's anything we can learn from here and nothing else, it is this fact that vitiligo is not contagious.
And doctor, does vitiligo affect certain skin tones more, or can anyone get it?
Yeah, interesting question. Vitiligo, you'll be interested to know that the whole of mankind has the same number of melanocytes. Whether the individual is light or dark, one melanocyte supplies about 36 cells in the surface layer of the skin. That layer is called the epidermis. We have the same number of melanocytes, but pigmented skins will make more melanin, and light-colored skins will make less melanin, and there are certain groups of individuals that have a slightly different melanin. But the amount of melanin is the same. So vitiligo can affect any individual, any color of individual, any race, any tribe, any ethnicity to the same extent. And the incidence is about 1 to 2% in the world. And this occurs on light skin, it occurs in dark skin. Of course, the issue is that on pigmented skin, it is going to be more visible. People see it. Whereas on light skin, for example, the guidelines in Scandinavia says for vitiligo that's not extensive, you don't have to do anything. I mean, you try saying that in Congo or Nigeria or South Africa, for example, where our skins are pigmented. You can see the contrast. And that is why it demands attention. So the incidence may be the same throughout the world. It affects all groups of people equally, but it is more prominent in those who have more pigment in the skin because the contrast is greater.
And doctor, obviously, it's really scary for a patient to suddenly have a patch. So can vitiligo appear suddenly, or does it develop slowly over time?
Either can happen. Sometimes people get up and they see this vitiligo for the first time. And at other times it develops slowly. There's one patch, then another, then another. It happens over years. Now, when we treat it, the vitiligo often goes away. So there is treatment for it. But it can come back, and this is another important concept to understand, that the immune cells that are responsible for creating vitiligo are called lymphocytes. And these are the body's policemen that's supposed to look after it from infection and so on, but they go crazy and they go and attack their own melanocyte for reasons that I explained about how that happens. Now, what happens in the skin is that these lymphocytes do the job and they leave, but you get some that remain in the skin. We call them resident memory T cells. They stay in the skin. Some years later, these memory T cells get activated, maybe because of stress, or maybe because of pregnancy, or maybe because the sunlight was too strong on that area, whatever the reason is. But they get activated and they start causing damage again. So that will then recreate. It can trigger off another episode of vitiligo. So although it is, in general, we would say that it starts in one place. In those in whom it remains in one place, we call it focal vitiligo. Focal means in one place, right? Then we have those who have vitiligo vulgaris. The word vulgaris means common, the common type. That's usually symmetrical. It's on two sides of the body. It happens because of rubbing from clothing and from shoes and so on. You get various types. And so you might get one that remains as one, so gradual or sudden onset, but it doesn't extend all over the place. And you get some that can extend, and it can extend pretty rapidly. But rapid spread all over the body is not common. We'll see it, for example, maybe once in 5 years or so, that somebody says they had vitiligo, now it's spreading rapidly. Maybe even less than that.
Listeners, if you just joined us, you're on Radio Al Ansar 90.4 in Pietermaritzburg 105.6 FM. You are with myself, Shabnam Ismail, and we are connecting to the community on the medical show called The Pulse. We are now going to take a quick pause. Don't go anywhere. We'll be right back to continuing conversation with our expert doctor specialized in the field of dermatology.
Needs your support more than ever. homes have been shattered and families have lost everything. With your support, our teams are delivering clean water tankers, feeding the hungry, and assisting orphans who have no one left. Let us give Gaza whatever help we can. African Muslims Agency, empowering, educating, inspiring.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickfield Road, Overport. Simplex Radio, the name you can trust.
Ladies, if you're looking for the perfect way to celebrate Women's Month, I found it. I'm Nazmira Kassem from The Breakfast Rush, inviting you to Her Mask, Her Story, where inspiration meets fun, friendships are strengthened, and every moment is made to remember. Tickets are just 300 rands. Book yours now by calling Al Ansar Outreach on 031 208 1601. Come along and be part of something truly special. See you there.
Radio Al Ansar, Durban 90.4 FM, Peter Maritzburg 105.6 FM.
Doctors and guests on a Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Listening to a live broadcast from Radio Al Ansar, Peter Maritzburg, 105.6 FM.
Feels emptiness inside, a never-ending rain keeps falling from the sky. Oh, turner of hearts, lead me on a straight path. Don't misguide me, don't let me walk away. Keep my heart close to you, I need you every day. When I'm lost, can you help find my way? Allahumma bismika amutu wa ahya. Allahumma inni as'aluka al-jannah. Oh Allah, you're the most that we praise all the time. So many signs, but yet my heart was blind. You're the one, there is no other way. Allahu Akbar. Turner of hearts, lead me on a straight path. Don't misguide me, don't let me walk away. Keep my heart close to you, I need you every day. When I'm lost, can you help find my way? Allahumma bismika amutu wa ahya. Allahumma inni.
Assalamu alaikum wa rahmatullahi wa barakatuh to our listeners on this Saturday morning on Radio Al Ansar 90.4 and Peter Marisburg 105.6 FM. I'm Shabnam Ismail on the Pulse Show, capturing the heartbeat of our community. We are here to have an open conversation about skin disorders and to shine a light on Virtiligo, a condition that impacts an estimated 1% of the global population. Despite how common it is, there's still so much misinformation, stigma, and silence around it. So Dr. Raboobee, a specialist dermatologist, is here to highlight causes, treatment plan, and how it can affect one's well-being, and most importantly, how we as a community can be more supportive. This conversation is about skin, science, and self-worth. So let's get started. Dr. Raboobee, welcome again to the show.
Thank you. Jazakallah.
Can you tell our listeners what triggers a flare of vitiligo and can it be cured?
Look, it's not always triggered off by something. Sometimes the patients tell us nothing happened. We always inquire about stress, though. And sometimes it's a birth or death in the family, or sometimes it is prolonged jet flights or flying overseas, and sometimes it is a problem in school. And there are many different triggers. Pregnancy also can trigger it off. So although we ask routinely about stress, we get a history of stress in about, I'd say about 40% of people. And in the others, there's no cause ever found for it. The stress is not the cause, but it's an associated feature. So those are the kind of things, and often it is stress. There's one issue that I would like to even also mention, is that when patients have vitiligo very extensively, we take all the color out and we call that depigmentation treatment. And sometimes strong sunlight can make the skin repigment in those areas. So this is a trigger of a flare-up in the other way, because generally we try to put color back and cover the areas. But when the vitiligo is affecting 90% of the body, we actually take all the color out and make the skin white. And there a flare-up would be where the skin starts becoming brown again. And that can happen during intense sun exposure and even pregnancy. I've seen that happen.
And doctor, tell us, do treatments like creams, light therapy, or surgery actually work? And what are the current treatment options?
We've made very big strides with regard to treatment of vitiligo. When I started practice about 40 years ago, the only treatment we had at that time was a topical steroid, and those who could make it to the clinic used to come in and have light therapy. Now, of course, there's a whole host of new treatments available. For example, if we look at topical therapies, these are treatments that are applied on the skin. So the corticosteroids are still used, but more recently the calcineurin inhibitors are being used now, and the topical antioxidants, because I mentioned to you what happens to the cell. It gets these oxidative particles, and then we use another new product these days that's called the JAK inhibitors. This stands for Janus kinase. It's an enzyme inside the cell. So the pathway to develop vitiligo involves this particular chemical, and so if we inhibit it, if we block it, then the cells don't secrete substances that end up damaging the pigment cell. And there are a few products in that range. Some of them are now available in the country. In this country, we don't have it commercially available, though. You've got to get it made up by the pharmacy, and it's hellishly expensive. So that is available. That is something new that's available. Now, when it comes to phototherapy, this has been done for many years, but this has also been refined recently. So again, when I started, we used to use ultraviolet light with Sorolin, and that was called PUVA. And subsequently, narrowband ultraviolet B light was created. It's called narrowband UVB because if you look at the light spectrum, it's in waves, and you take a narrow band from there. Ultraviolet light comes in cabinets, so the patients undress and go inside, and then the light shines right through the body. But you also get handheld units, so patients take that home and they apply it on small areas of vitiligo, and that's called home care phototherapy. And the recent advance there is the excimer laser or the excimer light. Now this is the most advanced form of ultraviolet light that we have, that is applied to the vitiligo area, but just locally on the areas where there is vitiligo. So we can get high amounts of energy.
And Doc, if summers in KZN can get a little bit crazy, why is it important for sun protection for someone with vitiligo?
Imagine that the skin has no color, and how important color is to protect us from sunburn. Those areas can burn in the sun, and we worry about skin cancers wherever the skin burns repeatedly. So sun protection would be very important. I think we got cut off a little earlier, but there are a few other treatments, and maybe when the opportunity is right again, we can discuss the rest of them. So the sunburn, and this is why sunscreen is so important for such patients, that when they are not on treatment. Now remember, if they're having ultraviolet light treatment, they've got to come without a sunblock because the light has to penetrate the skin. If you put a sunblock on and go for treatment with ultraviolet light, the light will just bounce off. But after the treatment is done, we use a sunblock to protect the skin from sun exposure so that those areas don't burn and don't develop skin cancers.
Doc, I think the next question is very vital and it's centered around how a community reacts with somebody diagnosed with vitiligo. Many people face stigma around visible skin conditions. So, what would be your advice on how can families and the community support them better? Because obviously, it's someone's confidence, it's a self esteem, and mental health is a huge problem.
We can advise them to be supportive rather than to be critical about the condition, to let kids know that this is a condition that affects people, and so not to stare and look and talk about them and let them see people are whispering about their condition, and then you go directly up to the patient and say, oh, were you burnt? Did this happen or that happen, or try this cream or that cream? People with vitiligo want to be integrated into the normal community. They don't want to be made to feel different. They need to be made to feel that they can integrate whatever the color is, whether there's patterns on the skin or whatever it is. I mean, there are many animals with beautiful colors, and we go and admire them and pet them and take photos with them and so on. So if there's a little bit of a difference in color, why don't we admire it in the same way? It's a design, it's a pattern, it's okay, And to let people know that this is just a normal individual who's just got a little bit of a setback with regard to color. It is treatable, it can be fixed up. And I think people need to be reassured also that there are lots of myths regarding food and myths regarding how it got there, and to blast those myths and let them understand what this condition is all about. The advice, of course, to parents and the community is to seek treatment early, because if vitiligo is treated in the first 2 years, there's a much greater chance that the vitiligo can be cured, can be fixed up. In other words, the color can come back. So our advice to the community is treat people with vitiligo normally. Don't make a special case out of them, and just treat them as though you would anyone else.
And the World Health Organization does take vitiligo very seriously. We just passed World Vitiligo Day, which was observed on the 25th of June. And Doctor, can you tell our parents that's listening to the show and whose kids are diagnosed with vitiligo, what advice do you have for them?
Yeah, the World Vitiligo Day, incidentally, is something that is celebrated on the death anniversary of Michael Jackson, for those who don't know this. Because Michael Jackson had vitiligo and the world refused to accept, and they said that he was trying to be what he's not, and he's trying to be someone else, and he's got a low self-esteem, and he's trying to project himself to be somebody different. And the World Vitiligo Day is now commemorated in every country on the planet, and South Africa has a World Vitiligo Day as well. Except this time we had a big meeting in India, and this was an international meeting where we had lots of support group meetings, and we have that in South Africa as well. There are support group meetings. We are going to be having one soon in Westville Hospital. And to answer this question, for those who are interested, for those who want to learn more about vitiligo and integrate with other people and meet others who have vitiligo and understand what kind of support is available and what kind of support they would like and what kind of projects they would like the Vitiligo Society of South Africa to undertake, please come and attend this meeting. We'll put it out on social media, and perhaps we'll let you know as well, Shabnam, if you can put it out somewhere, that this meeting is going to happen at Westville Hospital in the next few months. So,
Jazakallah, Doctor. Definitely information.
I think one should join a support group, and one should understand the condition and learn that there are treatments available, many treatments available. We only touch on some of them. You know that there's also systemic treatments. If the vitiligo is very extensive, we give the treatments by mouth. Then we do a lot of surgical treatments as well. In other words, we take out skin from the thigh and dissolve it and then put it on a vitiligo area. Those are surgical treatments. And in the appropriate individual, it can get very good cover. That is something to consider. I mentioned already the depigmentation. So this is what people need to know, it exists. Don't forget camouflage as well. You have a small patch on the forehead, you got a wedding to attend. For that day, you can cover it up and get some, feel a little better about it. And we often look at psychological and emotional support. So we get people to see the psychologist and discuss with the psychologist and get help from that point of view. And one other thing I must add is that one can choose not to treat it as well, right? It doesn't mean that if you have vitiligo, you have to have it treated. If you're comfortable with the way, for example, there's this model that's called Winnie Harlow, that she's decided she's going to keep her vitiligo. And then she creates a positive impression in the world about what this condition is. And that also gives a lot of hope and encouragement to patients. So support groups, yes. Helping patients to cope, Yes. So by explaining, and there's a Virtiligo Society of South Africa. I mean, I've just written a book on vitiligo. This book is available on Amazon, but the thing is, it's called Understanding Vitiligo. It's a 92-page book. But we've also got kids' storybooks that's available free. And this is available on the Virtiligo Society website. It's available on my own website. It's drnraboobee.com. So you can go and have a look there and download all these pictures. It's in 7 languages, by the way. They're books for children to create awareness, and parents can glean a lot of information from them as well. We've got it in English, in Afrikaans. We've got it in Arabic, in French, in Korean, and Hindi and Punjabi. So choose your pick and go and read them. And we're also thinking of doing some half in Arabic and half in English, so those who are learning Arabic can use this book to learn the Arabic, because they will see the English, they will see and we can develop it, in fact, to write the vocabulary and so on. Let me know if you want this kind of idea to learn Arabic. We can actually improve it with vitiligo storybooks.
Mashallah, Dr. Raboobee, especially with the diversity you bring into your field of medicine. Listeners, don't touch the dial. Grab a cuppa and we shall be back shortly to conclude the balance of our conversation with Dr. Raboobee on a topic of skin disorders. Stay with us.
For Conversation, Radio Al-Ansar.
For over 5 decades, Sunfoil has nurtured a legacy rooted from our land. From a sunflower seed grown with goodness and love, crafted through excellence, precision, and care. Proudly South African, and the only 100% pure sunflower oil endorsed as a diamond partner by the Heart and Stroke Foundation. Cook with confidence, serving the best to the people you love, from one dish to the next. Sunfoil, the heart of good cooking.
Feed your soul with knowledge. At the Al-Ansar shop, you'll find a wide selection of Qurans, Islamic books, children's literature, educational resources, gifts, and inspirational reading material. Whether you're beginning your journey of learning or expanding your Islamic library, we have something for every age. Visit the Al-Ansar shop today. Al-Ansar shop, inspiring hearts through knowledge.
This and only this is Nightline. Nightline is the only program that allows you to listen to the opportunity to voice your opinion on any matter or any topic that concerns you. Also on Nightline, we interview the famous, the not so famous, and infamous. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Brother Muhammad Variawa, and with me in the studio is Dr. Anwar Jiwa. Join us every Saturday night from 8:30 p.m. till 10:30 p.m. on Nightline, the program designed especially for you, the listener.
Radio Al-Ansar, 24/7, 365.
Doctors and guests on a Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al-Ansar will be held responsible for any ill health caused by the advice given on Radio Al-Ansar.
See, I don't need no reason, 'cause you provided healing. There were some hard times, we were living some dark lives. We did not know where.
Assalamu alaikum wa rahmatullahi wa barakatuh to our listeners on this Saturday morning on Radio Al-Ansar 90.4 AM Peter Marisburg 105.6 FM. I'm Shabnam Ismail and we are connected with the Pulse show, capturing the heartbeat of our community. So skin conditions don't define you. They are just a part of your story. So let's get back in conversation with Dr. Raboobee. So doctor, can you tell our listeners what other skin disorders do you treat?
A dermatologist is trained to treat any and every skin disorder. Anything that happens in the skin is a dermatologist's business. So we'd be happy to even listen from the audience and find out what worries them, and we can tackle them. But for example, we are talking about pigmentation, and another very big bugbear of our patients that come in are pigmentary disorders on the other side of the spectrum. For example, those that don't have vitiligo, but they have too much of pigment, and that is called melasma, for example, that occurs on the face and the cheeks, and not the easiest condition in the world to treat. Nevertheless, many treatments are available for that. We treat skin cancers, but I think we had a chat about skin cancers once on this program. And the eczema is another very big topic that we had a talk recently on Medical Chronicle, and a lot of the doctors had listened to that. But if you look at melasma, for example, this is the kind of pigmentation that happens on the skin, and then we can chat about psoriasis as well, which is a very common condition. So for pigmentation of the skin, we have certain procedures. For example, we do chemical peels for them to peel off that pigment and at the same time slow the pigment down. One can do micro needling, where you use tiny needles that go in and out of the skin, and we put a serum in there to lighten the skin. We use microdermabrasion to peel off a layer of the skin. But in addition to that, and at the same time, one's got to use an agent that helps lighten the skin along with the sunblock. So for example, one would use kojic acid on the skin. We would use hydroquinone, but one has to exercise great care with hydroquinone, because prolonged use of it can actually have the opposite effect. It can darken the skin. So there are some that are made by cosmetic companies, 1 or 2 ingredients that are applied in there. We use arbutin. So there are many different products. So if you see your dermatologist, the dermatologist will have a look and individualize the treatment for you, and have a look and decide what component of the lightening agent you particularly need for your condition. So there isn't a blanket rule that if you have pigment on the skin, this is what you use. The treatments are always individualized. For example, in psoriasis, another very common condition that we treat, we have new medications available now for psoriasis called the biologics. And the biologics are in fact amazing in the way they work. And patients who have 100% of psoriasis covering their bodies from head to toe, they come back after the second or third injection with absolutely nothing left on the body. It's all gone. And for those that have extensive psoriasis, please make your way to your dermatologist and find out about this new class of medications that can help the psoriasis. For atopic dermatitis, there's also new medications. There's a biologic for atopic dermatitis as well. Patients with very severe atopic dermatitis, they do well on the new biologics and the new JAK inhibitors, the Janus kinase inhibitors. The Janus kinase JAK inhibitors are given by mouth, and the biologics are all given by injection. So there are biologics now available for psoriasis, for atopic dermatitis, for urticaria, where there's, those welts that develop on the body like whip marks. And some patients are really troubled by urticaria. They can't get it under control with antihistamines. There are these biologics available for that as well. So why I'm mentioning this is because the biologics are an entirely new concept and type of treatment that have not been available in the past, that has absolutely revolutionized the treatment of skin conditions.
Dr. Raboobee, I'm going to take a step back, and you mentioned something important about the skin lightening products and the treatments. Are there dangers with overusage?
Yes, absolutely. For example, if one looks at hydroquinone, in the 70s and 80s, there was absolutely excessive usage of hydroquinone by the local populations, and they ended up with permanent blackening of the skin. So much so that if you take a biopsy and have a look at it under the microscope, you'll see this banana-shaped, yellowish damage to the collagen that one sees. That's permanent. There's no way that we can reverse that. So the government actually banned the use of hydroquinone over the counter at around that time, in the 70s, 80s. When I had started dermatology, it was already banned, and one could only get it on prescription. So these are the problems associated. Some of them have lead and some of them have mercury, and those substances themselves have their own issues, and arsenic and so on. So if there are these chemicals inside the products, of course there are chemical ingredients that can also cause allergic reactions. Allergic reaction is not limited to things that are harmful. It can happen even from normal, ordinary substances that one uses every day, and preservatives and so on. But the point is, specifically with these light damage of the skin if it's not used appropriately. My suggestion is that you discuss with your dermatologist what exactly you're going to use, how long you're going to use it for, and what percentage it should be used at, and what to use once that controls it, because one shouldn't carry on and on and on with these strong medications. And at the same time, if it's under supervision, your dermatologist will actually look for problems associated with it and give you the advice that you need about how long and when to stop and so on.
Doctor, I'm sure a lot of our listeners do have teenagers at home, and typically, through puberty, they have acne. So any advice on skincare or good habits to maintain their self-esteem?
Yeah, acne is a treatable condition, and nobody in this day and age should get any scarring from acne. If anyone gets a scar from acne, we have failed in our duty to protect them. And they have failed in their duty to seeking such help when they need that help. And I think they must realize that treatments are available, the treatments are usually considered to be safe, and side effects can occur from any medicine, right? You can go outside and you can get a side effect without even taking any medicine. So the point is that be aware that these medicines are available. You consult with your dermatologist who will guide you through the medications that you need, and there's a stepwise level of care when it comes to acne. For example, we start with external medicines. You'll use a decent face wash, you'll use a decent cleanser and moisturizer and so on, but there are specific medications to open the pore out and to stop the whiteheads from forming and the blackheads from forming. And then there are the antibiotics that kill off the bacteria that get in the skin that allows the acne to settle. In females, one could use an oral contraceptive to control the acne, and that works very well when it comes to controlling the acne. But then there's also another medication that's called isotretinoin that one should not waste time about using it. If one needs it, and there's a time and a place to use it. There's little point in coming back 5 years later and saying, okay, I'm now ready for it. It's not the time. So your dermatologist will guide you about it. So trust the dermatologist when it comes to the advice given to you with regard to when you should and when you shouldn't, and have a decent discussion so that it's not a monologue, it's a dialogue between the two of you. My own philosophy is I would tell the patient about the medication, and if the patient says, no, I'm not interested, we stop the discussion right there and go on to substances that the patient is willing to take. So nobody is ever going to force you, remember, that they will tell you about it, and if you feel that it's not something you want to take, just say this to the dermatologist, and I'm not interested, and there it gets left, and what you're willing to take gets discussed. And I'm sure our profession is generally like that they would go by what the patient wants to do at the end. And we would
So, doctor, what are
please.
three daily habits everyone should follow for healthy skin? And what are your final words if someone listening is struggling with the skin condition right now? What is the first step they should take?
I think in this day and age and in the climate we live in, it's important to use a sunblock on a regular basis. A general cleanser and moisturizer is what we do on a routine basis. Look out for things and go for treatment early. If you see a bump, a lump, anything in the body, please do not sit with it and draw pictures of it or discuss with neighbors and friends and so on, or put it on social media. Go and see your dermatologist and find out if that particular thing is dangerous or not. Remember, early diagnosis results in a greater amount of benefit when it comes to treatment. And healthy skin contributes to a healthy life. It's what people see when they look at you, and it's important to keep it healthy and as healthy as you can. And the advice I can give is that go and see your dermatologist regularly, discuss the issues that are there, and treat early. That's the final departing word that I have for you.
Dr. Raboobee, it's been an absolute pleasure having you on the show, but there's so much areas we haven't covered, and definitely we'll have you on the show again. Jazakallah so much for the work that you do and all the other medical professionals out there. To our listeners, as we conclude our discussion, let's take a moment to reflect. May Almighty Allah put what we have spoken about into our hearts and grant us the strength to act upon it in our daily lives. Remember, knowledge without action has no fruit. Even if one point from my show today helps you, your family, or your community, then Alhamdulillah, our time was well spent. To our listeners, shukran for tuning in today's episode of The Pulse. To the Radio Al Ansar team, especially the technicians, Jazakallah for plugging us. Al Ansar Radio is the voice of hope, healing, and community. Jazakallah. Assalamu alaikum. Until next Saturday, inshallah.
They do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better.